Welcome to this explainer. Today, we're diving into a genuinely fascinating medical mystery surrounding men's health, and my goal here is to completely eliminate the dread around a very specific, totally misunderstood assessment, the PSA test. You know, for decades, the prostate has been this totally misunderstood organ, and prostate cancer is something a lot of folks only whisper about in fear. But today, we're bringing it right out of the shadows. We're going to use the latest insights from medical experts to unpack exactly why this disease operates the way it does and why the anxiety surrounding this test is honestly completely misplaced.
Let's kick things off with a staggering statistic drawn straight from medical data in Japan. Right now, 1 in 13 living men there are diagnosed with prostate cancer. I mean, just think about how many men you interact with daily. 1 in 13. It's officially the #1 most common cancer in men. And when you hear a stat like that, it sounds incredibly daunting, right? It feels like this massive, looming threat hanging over a huge chunk of the population.
But wait, here is where the mystery really gets wild. When autopsies are performed on men who passed away from entirely unrelated causes, old age, a heart condition, whatever it might be, 1 in 3 men are found to have had prostate cancer without ever even knowing it. It's the #1 most common cancer in terms of cases, yet it's only #6 in cancer deaths. Think about what that actually means. It's a genuine paradox. So many guys are living their entire long lives with this cancer, totally unaware, and end up passing away from something else entirely.
So, the obvious question we have to figure out is, why is the most common cancer in men completely silent? How in the world can a disease so incredibly prevalent, actively growing inside the body, have absolutely zero initial symptoms?
Well, it all comes down to plumbing, basically. Picture the prostate gland as having 2 main sections, an inner portion and an outer portion. Now, benign enlargement, which, by the way, is just a totally normal part of aging for men, happens right there in the inner gland. Because this inner section wraps snugly around the urethra, kind of like a donut, any enlargement physically squeezes the tube, blocking urine flow and causing immediate, highly noticeable symptoms. But cancer, it behaves totally differently. It typically starts and grows in the outer gland. It's completely away from the urethra. So that means it doesn't block urine, it doesn't cause bleeding, and it just kind of sits there, silently growing in the background until it gets really large.
And look, this is exactly why waiting for a sign is the absolute worst strategy here. By the time a man actually feels symptoms from prostate cancer, you're looking at a huge glaring warning sign. If a patient waits until they experience something highly noticeable, like severe lower backbone pain or blood in the urine, the cancer has very likely already spread out of the prostate and into the bones. At that point, doctors are probably looking at a stage 4 scenario, which obviously makes treatment significantly harder.
Section 1. Enter the hero, the PSA test. This is exactly why we cannot wait for symptoms. It brings us to a remarkably simple, inexpensive blood test, and it's basically the ultimate tool for catching this silent ninja of a disease years before it ever causes a problem. So, what is this test exactly? PSA stands for prostate-specific antigen. Simply put, it's a unique protein found exclusively in the prostate. Now, the cellular mechanics here are super fascinating. When prostate cells break down, whether that's from cancer, a simple infection, or just general wear and tear, this protein essentially leaks out of the prostate and right into your bloodstream. A PSA test just measures the amount of this very specific protein floating around in your blood.
When you get your blood work back from the lab, the standard baseline value you want to see is a 4 or below. If it's under 4, you are generally in the clear and can just confidently go about your year. But, and this is a massive but, if it is higher than 4, do not panic.
Section 2. Truth number 1. A high PSA isn't always cancer. Let's really dive into this, because this is where so much unnecessary anxiety comes from. A high score absolutely does not mean an automatic cancer diagnosis.
If your score comes back in that ambiguous gray area, somewhere between a 4 and a 10, only about 1 in 3 or 4 men actually have cancer. So what is causing the rest of that high PSA? Well, the vast majority of the time, it's just benign prostate enlargement, an infection, or, get this, even physical stimulation from sitting on a hard bicycle seat for a long ride. Yeah, a weekend bike ride can literally artificially spike your PSA. It's crazy.
Which leads us perfectly into the panic-free diagnostic journey. Imagine the relief of knowing you don't have to rush into an operating room based on the single blood test. It's a marathon, guys, not a sprint. If your first test is high, the doctor isn't going to rush you to surgery. They'll just ask you to wait 3 months and retest. Why? Because if the spike was just inflammation or that long bike ride, the number is going to drop naturally on its own. If it does stay high, then you get a super detailed MRI, and only if they see a suspicious shadow on that scan do they actually proceed to a biopsy, which, thanks to modern anesthesia, is completely painless.
Section 3. Truth number 2. Cancer doesn't always mean immediate treatment. Let's say you go through all those steps, the biopsy is done, and it actually is cancer. Here is the second truth that should ease your mind. Finding cancer doesn't always mean immediate, harsh intervention.
When doctors do that biopsy, they look closely under a microscope at what they call the face of the cancer cells. They use a grading system called the Gleason score to basically determine the cancer's personality. Cancers aren't all the same monster. They want to know, is this a truly bad, highly aggressive, fast-moving cancer, or is it a really slow-moving, incredibly lazy one? A low Gleason score like a 6 means the cancer is barely a threat. It's slow, it's low-grade, and it's very lazy.
For those low-grade, lazy cells, doctors use an awesome approach called active surveillance or observation therapy. This is a huge paradigm shift from the old days of cut it all out immediately. Modern medicine actually chooses to do nothing invasive in these cases. No surgery, no radiation. They literally just monitor your PSA levels every 3 months to make sure the cancer isn't growing. You completely avoid all the harsh side effects that impact your quality of life, you skip the invasive treatments, and you just get to live your life normally.
Section 4. Navigating your treatment options. Now, what if the microscopic face of the cell does look a bit more aggressive? Well, if you do have a faster-moving cancer that needs intervention, you've got some highly effective options today.
You basically have 3 main paths here. First is hormone therapy, which is an excellent first step, because prostate cancer actually feeds on male hormones. Suppressing them can dramatically stop the growth or even shrink the cancer. Then there's radiation, which uses highly targeted energy. And finally, robotic surgery. And wow, this is where the medical advancements are just mind-blowing. In the old days, removing a prostate meant terrifying blood loss, up to 5 liters. But today, with precision robotic surgery, blood loss is down to a minuscule 10 to 20 cc's. That is an absolute game changer. It's incredibly safe.
Now, here's a really fascinating piece of strategy doctors use when choosing between these options, especially regarding the order. Because the prostate is incredibly rich in blood vessels, surgery removes the entire gland at once. If you opt for surgery first and the cancer ever happens to return down the line, you've got a clean slate to easily use radiation later. But if you do radiation first, the targeted energy turns the surrounding tissue kind of mushy and damaged. That makes any future surgery nearly impossible, so it's a critical tactical decision to keep your options open.
So here's your playbook. This is exactly when you need to act to keep yourself fully in the driver's seat. The timeline is super simple. Start your annual PSA testing at 45 years old if prostate cancer runs in your family. For all other guys, start testing at 50. And then, most importantly, repeat that simple blood test every single year.
We've essentially taken this silent ninja and totally unmasked it. By demystifying the PSA test, we can clearly see it's not a ticket to panic, but a tool for incredible empowerment. Knowing that this disease is highly treatable and often entirely harmless if caught early, will you really let fear stop you from taking a simple, potentially life-saving blood test? The choice is completely yours. Take charge of your health today.